All right, you're looking live outside the White House right now, where some state insurance commissioners are meeting with the President of the United States. These are very powerful folks, my friends. These will be the folks who ultimately decide whether this delay the president has recommended so people wouldn't be junked from their plans sticks. He might be the leader of the free world. They actually move healthcare in this world. We will know soon. Welcome, everybody. I'm Neil Cavuto to Ed Henry with the latest showdown going on. Ed.
Neil, you're right. These commissioners hold a lot of sway because they're going to help decide whether or not the president can implement this executive fix that he was talking about last week that would delay by a year the folks being pushed off their current plans, those folks who have gotten cancellation letters, trying to fulfill that promise that had been broken by the president that if you liked your plan, you'd be able to keep it. The challenge for the president, of course, is trying to get these state insurance commissioners to agree to that, even though folks have already been setting the premiums for 2014, et cetera, and do not necessarily want to change midstream here. Of course, the reason the president wants this executive fix and not a legislative fix on Capitol Hill is that he realizes he's been losing support on Capitol Hill. You know, not only has Republicans who have been critics of this law from the beginning, but he has some Democrats, particularly in the Senate, facing the voters in 2014 who have been calling for some kind of legislative changes to the law. That's why yesterday the president pushed back and insisted he's going to fix this on his own, number one. And Republicans today fired back at the president's suggestion that somehow Republicans were to blame for all of this. Take a listen.
We are going to have to, A, fix the website so everybody feels confident about that. We're going to have to obviously remarket and rebrand. And that will be challenging in this political environment.
It's one of the silliest statements that I've heard made so far about the law. There's nobody's fault on the Republican side that the exchange website isn't working. It's nobody's fault on the Republican side that millions of people are in fear of losing their existing coverage.
Of course, the other pressure on the president right now, there have been a whole series of national polls suggesting support for the health care law itself has been slipping, but also specifically pressure on the president to make changes. A new CBS News poll out today saying 43% want to repeal the law altogether. 48% at least want some sort of changes, Neil.
All right, Ed, thank you very much. Ed Henry. Now, if the president gets his way with these guys, Bob Leshevsky says everybody better get ready to pay. What do you mean?
Well, if they are able to, first of all, they're not going to change much here. The biggest problem you got with these insurance commissioners sitting in the White House is the president 1 week ago told the insurance companies he wanted them to rescind all the cancellations, told them they had to do that in just 1 month. Everybody's got to sign up by December 15th. That was only a month away. Here we are a week later, and they're still talking about it as to whether they can do it. Now we've got 3 weeks to do the impossible. 30 days was impossible.
I just want to, when you say it takes that long to do, I mean, it's easier said than done. So, ironically, this inconvenience for a lot of folks when their policies were being rescinded or their rates hiked, it's tough to put the genie back in the bottle. Why is that?
Exactly, because first of all, it took the insurance companies a month to get ready for months to get ready for Obamacare here. Here's the irony. The Obama administration wasn't ready for Obamacare. But the insurance industry did what the Obama administration told them to do, and they were ready. It took them many months to change all of their computer systems, send the original cancellation letters out they were required to send out under Obamacare, help people start thinking about the changes they were going to need to make and all these things. And now you say with a month's notice, take 4 or 5 months' notice, turn on a dime, redo it all. This from an administration that can't get a website up in three years. That's a mess. They're telling the insurance industry to turn on a dime. And that was when they gave them 4 weeks to do it. Now we're 3 weeks away, and the insurance commissioners are talking to the president about it. I mean, this is almost impossible. Neil, what's going to happen here in reality is that many health insurance companies in many states were able to give their customers early renewal options. It's a technicality, but what it means is there was a way for these people to keep their coverage for about a year anyway. And I think in the end, most of these insurance commissioners and most of these insurance companies are going to sort of stand pat on the early renewal offer they made, and people will be able to keep their coverage for 11 months, not 12 months.
All right, but at the same rate? Will at the same premium, or
yes,
are they going to have to pay more?
At the old rate. Now, there's an inflationary adjustment every January. Healthcare inflation right now is running 6 or 7%. But at the old rate plus a few points for inflation, not at the rate that might be 20, 30, 50% higher. So
Well, wait a minute. I want to be
renewal
very
program
clear. I'm
does
sorry. This is a point that's very crucial,
Yeah.
I think. These policies that are extended for a year, assuming that's the case, will
Yes.
they adhere to the president's standards that, you know, you cover pre-existing conditions, kids could stay in
No.
the policy longer? That's just what I thought, because now we have a two-tiered policy system,
Yes.
which aggravates what we already were supposedly trying to correct.
Well, Neil, most of the insurance companies were giving their policyholders a one-year stay of execution, if you will, to stay on the old rate base. Pre-existing
Right.
conditions don't matter to them because they're covered already.
Right.
But they don't have the new mandates and so forth, but they also have the policy these people chose, and it's more affordable. These people also, if they want to do early renewal, have the option to go to Obamacare if they want to. Nobody was prohibiting them from doing that. It was the customer's option. So I think that so many people were offered the early renewal, which gets people to the end of 2014 anyway. That's where most of these insurance commissioners are going to stay. But your point that that not moving people into the new pool undermines the fiscal integrity of the pool. You don't get all these healthy people moving into the new pool is a good one. You've got to get everybody into the Obamacare pool in order to help make the Obamacare pool sustainable. That's going to be the president's objective ultimately.
That's a big problem.
Yes, big
Bob,
problem.
thank you very much. We're going to be exploring that in a lot more detail tonight on Fox Business, why young people are not moving into that pool. Might surprise you. Well, even if states gave the president his one-year delay, Paul Briskowski wants to know what happens after that. Now, he lost his health plan because of the new law, and he's not really encouraged by some of these changes being discussed now. Explain what happened to you, Paul.
Well, first, as soon as the Health Care Act was enacted, my premiums went up twice in 1 year, so I decided to get a catastrophic policy. And then I recently got a letter that said my policy was canceled.
So the times
And
the times they went up, the first time and the second time, how did they explain why they went up?
They didn't explain that. They just went up for whatever reason, but it happened to occur right after the affordable health care was enacted. It became
Gotcha.
less affordable. And I actually changed to another company, and I went just for a catastrophic plan with a low premium, high deductible. Now I have a choice to get the same plan, which is double.
Double.
So, and I have to do that by January.
All right. I don't mean to get personal, Paul. You don't have to answer this. Do you have any pre-existing conditions or something like that that would warrant a doubling in your premium?
Absolutely not. I'm very healthy. That's why I went for the catastrophic.
Gotcha. So how was that explained, why the premium would have to double? That's more than like a 10 or 15% or 20%, as we've seen sometimes among people on the show. That's big.
They just said because of the new Health Care Act, it was going to be doubled.
Did you have
Or that it would be
did you have a
canceled, and-
substandard plan? As the president had been calling them plans that didn't cover everything they should, or what?
Right, yeah. Well, it was a catastrophic. I got 2 visits per year with a $40 copay. I got a free physical every year. You know, and it was a low premium, and that was my choice to get that type of plan. Now I have 4 choices if I want to go on the government site, and those are double that price as well for the lowest plan, and that's with a high deductible. I think that's a $5,000 deductible.
Holy Toledo.
So, yeah.
When you hear from the administration and others advocating the health care law, whatever your political views are, they say that cases like yours are the exception. They're not the rule, that far more will benefit and pay less than folks like you who are getting zoomed and paying a lot more. What do you think and what do you say?
I think that's wrong. I mean, I don't make a lot of money, and you know, this is just limiting my freedom. I think the president told us that we could keep our plans, and I think he just lied. I think he lied to push, you know, the health care through, you know, and I think it hurts everybody in the long run. I think this isn't going to help anybody at all.
Are you able to take advantage, if these insurance commissioners approve it, of a 1-year extension the president first proposed?
Well, I don't know, and I don't understand how that's going to happen. I mean, who's going to pay for all this paperwork and all the,
Good point.
you know, those are just words. I don't believe that,
Amazing.
you know, I think there's a lot better choices to create a free market and let the insurance companies, you know, open up. Right now we have 4 choices from what I can see, and it's limiting everything. And now I have to pay for maternity and a lot of other things that
Amazing.
are
Amazing.
necessary.
Hang in there, Paul. Thank you for sharing your story, though. You're not alone, because we're hearing a lot more just like it. In the meantime,